Good morning, everyone. My name is Rachel, and today I'll be delivering the technical pitch for joint venture. Adalimumab, or ADL, is a monoclonal antibody that works by binding to and inhibiting tumor necrosis factor, or TNF alpha. Of the 400,000 patients suffering from rheumatoid arthritis in the UK, up to 24,000 of them have been prescribed with ADL to cope with their condition. However, they have been known to suffer from many side effects, such as an increased risk of infection due to their compromised immune systems. Therefore, a biosensor which measures the concentration of ADL is of utmost importance. Our biosensor far surpasses any test that is currently on the market. Firstly, each test only requires a small sample volume of as little as 3 microliters of plasma. Next, the sample is only diluted 2.3 times by our reagent and can give a reading in as little as 5 minutes. Finally, because the main reagents in our reaction are gold nanoparticles and magnetic beads, these can be produced in bulk and easily characterized before addition to our biosensor, ensuring good reproducibility. In the first step of sensing, a sample of plasma is added to TNF alpha coated magnetic beads. A patient with a high concentration of ADL would have most, if not all, of the available sites on TNF alpha being occupied. In the next step, the detection molecule, ADL coated gold nanoparticles are added. These ADL molecules are then free to bind to any remaining sites on TNF alpha. Finally, a magnet is used to draw the complex of magnetic beads and gold nanoparticles that has formed down, resulting in any unbound gold nanoparticles being left in the supernatant, resulting in a red-colored solution. On the other hand, a patient with little ADL in their plasma would have most of the gold nanoparticles bound to and removed by the magnet, resulting in a colorless solution. The intensity of absorbance of the supernatant is then measured using our spectrophotometer. The image on the right shows that of a cartridge that we have used in all our measurements. A light is shone on the sample, and the intensity of absorbance is compared to plasma, with the intensity of absorbance being proportional to the concentration of ADL. Our biosensor brings together well-established and reliable gold nanoparticle, streptavidin biotin, and magnetic bead chemistry. To date, there is no commercially available biosensor that brings all these technologies together yet. Next, in a bid to make our biosensor more environmentally sustainable, we explored the area of green chemistry. First, using honey as a reducing agent to synthesize gold nanoparticles, and to work with companies like Greencast to make recyclable acrylic cartridges. Finally, our biosensor is accompanied by an app called ADA. ADA is connected to our biosensor via the Wi-Fi and allows any information collected to be sent directly to the app. It allows patients to log their symptoms and level of pain using a sliding scale from green to red. Additionally, any data collected is shared with the doctors, ensuring better doctor-patient communication. In the future, we aim to make our biosensor compatible with not only plasma, but blood as well. In addition, we hope to use our biosensor in the treatment of other inflammatory diseases, such as Crohn's disease, in which patients are frequently prescribed ADL. Thank you, and we're happy to take any questions.
So thank you. So jury, is there somebody that has a question? Yeah, can you please pass?
Okay, thank you very much. Thank you for your presentation. It was very clear. I think it's also a very interesting idea which your solution is based upon, is to use the magnetic beads, basically also solving a transport problem. And then what you do is basically you remove the particles from the sample,
Yes.
and you measure the residual signal. But that's also a very clever idea.
Thank
So
you.
it's interesting to see that you just measure the absence of the adalimumab. I'm wondering about if you want to make this more commercial. From what do you know about the stability of the chemicals you use, and where are you going to when you think about making a disposable use? Are you thinking about storage conditions on the chip? What about maybe conditions of storaging of the cartridge? Can you tell something about what you expect when you go through the development towards the
Okay.
shelf life?
Okay, sure. So I think the main components in our whole reaction are the proteins and the gold nanoparticles and the magnetic beads. So we know that proteins are not very stable. They denature easily based on like temperature, pH, all that other factors. But based on like all the experiments we have done so far, simply just storing the gold nanoparticles and the magnetic beads in the fridge at 2 to 4 degrees is more than sufficient. They do not have to go into a freezer or anything, extremely low temperatures. As
The cartridge at the moment, we haven't planned on preloading any reagents because we want to expand our sensor into other diseases. So if we have a plain cartridge, we can load multiple reagents into it without the need for development of separate cartridges for each test.
So if I can comment on that, that means that you will also stay in professional surroundings when your measurement device will be used.
Yeah, eventually we'd want to use some kind of lab on a chip or some kind of microfluidics to do the mixing automatically. So but for now we're using standard pipetting and lab procedures.
Thank you. In relation to that, it's not on anymore. Not on? Yes. On? Okay. It's a very good question. And in relation to that question, so you have to prepare the assay before each measurement, is that correct? How long does that take? How long incubation time, and how long does that preparation step take?
So in each step, firstly, when we add the plasma to the magnetic beads, we mix it for 1 minute.
Yeah.
And then we add the gold nanoparticles and mix for another minute as well. And then finally, when we let the magnet draw down the complex that has formed, that is 30 seconds. And when the spectrophotometer measures the intensity of absorbance, that is another 30 seconds. So all in all, it's less than 5 minutes, about 4.5 minutes.
Including pre-preparation?
Yes,
What
including.
about the incubation of the assay? That normally takes longer?
We do it for a minute.
For a
Like
minute?
all the mixing steps are a minute using our micropipette because we are mixing it directly.
Right.
We're not just leaving it to like diffuse or anything, yeah.
So including pre-preparation
Yes.
and everything without any preloading on your
No.
chip, you are able to do this in
Yes.
5 minutes.
Yes.
That's excellent. Thank you.
So I do have a question. When you have a lot of adalimumab, do you get aggregation of the magnetic particles? You get like multiple binding?
Like between the magnetic particles,
So
or
if you go back maybe one
Okay, sorry.
slide.
Yeah.
There you go.
Yes,
So
okay, yeah.
if you have a lot of adalimumab, can you have two particles being just bridged by the antibody?
okay. So what we did is that to block any streptavidin sites that could be present on the magnetic bead, we added free biotin to block all those sites. So there would not be any available sites on. Oh.
Yeah, I understand, but maybe the question is more related to the antibody by itself has two binding sites.
Oh yes. Okay.
So can you essentially cause aggregation if you have very high concentration of antibodies, for example?
That
or
I think
even
that
low
is a
concentration?
possibility that we did consider, and we haven't gotten around to solving it either. So one suggestion that we got from our sponsor is to use a blocking solution which contains non-interacting proteins to just prevent any non-specific binding.
Thank you very much for your presentation. I have one question. You start with your magnetic beads with TNF alpha
Yes.
bound to it.
Yes.
In theory, that would mean that you could also measure other monoclonal antibodies that bind to TNF alpha, right?
Yes.
Something like, so if you have a patient that goes from infliximab to adalimumab,
Yes.
you might have a problem in detecting not only adalimumab but both,
Yes.
right?
Yeah.
Okay, okay. The other question I have is that it is known that in some cases patients can form antibodies to monoclonal antibodies. Do you have any results on possible interference with your assay?
I think we're not entirely sure. Okay.
Yeah.
We do know that there is a problem with non-specific binding, just because there's so many proteins in the plasma that can bind to TNF alpha and
Yeah,
everything.
but I'm not going in the direction of non-specific binding.
Okay.
I'm going in the direction of patients that have antibodies to adalimumab,
Yes.
which might prevent the adalimumab that you want to measure from binding to TNF alpha.
No, we did not
Okay.
have any results for that.
Okay.
Sorry.
Yeah.